name is Moses Segwai Kamagelo. You all know me as Kamagelo, but MK stands for Moses Kamagelo, and my surname is Segwai. Anyways, I would like to take the opportunity to give appreciation and thanks to the school at large. One, for for granting me the opportunity to be here today, and then also for welcoming. Today, when we're talking about health, we're gonna be talking about this. What is the importance of having to visit any practitioner, any health practitioner, on a random day without any disease, without you feeling anyhow, just taking a decision that today I want to visit, so be it, a physiotherapist, for instance. So number one, the reason for the importance of regular visits, number one, is for preventative treatment. We always advise that people should be taken to health practitioners while they're still young, so that uh, diseases may be seen earlier, so that they may be prevented. However, if such is missed, and then a person comes with a disease of some sort, we have interceptive treatments. That's when now we have to intervene, because of already you have that particular disease. Sometimes, unfortunately, one is born with a disease, so we have to intervene earlier rather than having to intervene at a later stage. Then, most importantly, after having to deal with the disease and maybe taking it out or dealing with it successfully, we have to maintain the part of health so that we may not regress or go back. So this reason goes to why actually do a person, or rather does a person have to wake up and just say, I'm just gonna see a medical practitioner or a dentist without any sort of disease, is to prevent disease. Going further, we just using examples of practitioners. For instance, we can talk about physiotherapists as to what they do, because of a lot of people don't really know what other people do. So we mostly know about medical doctors. So what physiotherapists do, there's a list, such as sports injuries, chronic pain management, and neurological rehabilitation. This simply means it relates mostly to older people. The second point, chronic pain management. Older people would be coming with things like arthritis. Parents would only be taking pain medication when they have those pains. However, taking pain medication is not treatment. So physiotherapists do advise that you have to come for regular visits. There are things in muscles called knots, and then as times go by, there are changes in the body. So when you visit physiotherapists, you get to be treated or managed well, in as much as your arthritis is concerned, so that you avoid taking medication, because of the same medication that we use to ease pain, or what, still come with what they still come with side effects and many more. So at times, even when you use that particular medication, you get to a state where that particular medication you're using is no longer working, so you have to go to a better one. So the aim is that, let us not necessarily, it's called palliative care. Palliative care is that care that every time you only respond to health when you are sick, and then you need pain medication or maybe antibiotics, something like sort. So we advise that you should not wait for that. Rather visit uh, health practitioners, so that pain and every other thing may be prevented. Another thing, we can make example with dietitians. It is of utmost importance to visit dietitians. Dietitians, one, they will help us with, remember, nutrition. It's a pivotal part of a human being, because of on a daily basis you eat, and not merely to get full. We eat so that we may get nutritions, and those nutritions make components of our bodies. So as a human being, we differ in a lot of states. As a human being, you need to know it's called a dietary recall. You need to know your dietary recall. You need to visit a dietitian, so that he or she may advise you that because of this body type, one, because of this skin type, because of this kind of posture, because of your spine is like this and that, I would prefer for you to have this kind of diet, because of it consists of this certain nutrients. For instance, you may be needing sodium, you may be needing things like fluoride more than the other, so you wouldn't know per se. So visiting dietitians may help you do that. It also prevents nutrition related disease, like for instance obesity, things like kwashiorkor, so that you may know that even despite me aging, I do not run a risk of falling sick because of the food that I eat. So these are simply examples that illustrate my point as to why a person has to visit dentist. Now there's this phenomenon referred to as field of cancerization. Field of cancellation, I refer to it. I don't know if you can see it clearly. There's a mark there. We refer to it as a susceptible mark. A susceptible birthmark. Everybody has a birthmark, and birthmark is natural. It is not even painful or anything of some sort. There's this thing referred to as field of cancellation. Field of cancellation is what? It's a random point in a body. It may be anywhere. You can't see it with your own eyes. You have to visit practitioners so that they may take special x-ray so that they may see it. If it is there, it is not there in all of us. It is by chance. So as a human being is being formed in the embryo stage, this human being is being formed, there's a lot of things that may cause one to have this point referred to as field of cancellation. Field of cancellation is one point in a body that is susceptible to having cancer without you doing anything. It is just by chance. This takes us back to why a lot of us come with things like breast cancer, cervical cancer. This thing might have started a long time ago, so it grows with time and age. So we advise that do not wait for it to present itself. Rather, visit practitioners so that they may detect it and then treat it duly, treat it in time. So it is simply something like that. So this still illustrates field of cancellation. This is just a radiograph that shows teeth, but then this person did not feel any pain or anything of such sort. So when you take an x-ray, then you see an aberrant thing, you see something very strange, and then you have to know that okay, there's some sort of cancer developing. It is prudent that this patient came because of now it is still very minimal, in a sense that it may be treated or cut successfully without having to affect a detrimental part of the body. So this takes us back to why a person has to just wake up and go visit any sort of a health practitioner. So going back to dentists, more of dentists, they promote oral health, they restore oral facial structures like having to patch your teeth and other things. They do dental rehabilitation, e.g. false teeth. So now, without any waste of time, what are the most common dental diseases? Most common dental diseases are such: periodontal diseases. ECC simply means early childhood caries, and then caries simply means rotten teeth. Layman's term is rotten teeth. And then malocclusion. I'm going to demonstrate with pictures as to what these are. So this is periodontal health. We always advise for one to visit dentist on a regular basis. What happens is that I would like to demonstrate. What happens is that each and every one of us eats on a daily basis. So there are things like a tooth. A tooth is embedded in bone. After being embedded in bone, it is put in bone like that, and it is covered by gums. There is a small space between your tooth and the gum. It's called the sulcular area. As the person eats, food goes in there, and even when you attempt to brush, the bristles or the fibers of a toothbrush may not reach this particular point. Because of this thing called oral flora. Oral flora is basically bacteria that remains in the mouth. It is healthy. It helps us with things like digesting food that is in the mouth. But when it finds food that may not be removed, it becomes lethal. So now it starts feeding on the gums itself. It's no longer feeding only on the food that may be removed. So this bacteria gets stuck in the gums, so it starts eating away the gums and then getting the gums to get swollen. With that, the signs that are apparent would be sensitivity or maybe bleeding when you brush. If you still don't visit dentists in such instances, that thing progresses and continues. As it does, it goes and eats away the gum, and then it goes and eats away the bone underneath. Hence you'd see, especially with grannies, their teeth, since they've lost structural components, they would just shake and fall. So these are simply structures that demonstrate this. This is a person that has periodontitis. Periodontitis is basically this bacteria that eats away gums with irregularities, eats away gums. So what we do when you come, we take you under this thing. It's called periotherapy, where we try to rehabilitate the gum so that you may be better. And then from there, going back to the same point, we try to encourage you to maintain health so that you may not go back. This is one of the most common ones. ECC simply means early childhood caries. So this thing, remember, there is this thing referred to as Road to Health book. After just giving birth, you're given a book so that it may encourage you as to how you take kids to clinic for vaccinations and other things. There also is a page that speaks to dental, that shows you what kind of food you have to give your child, how you should bottle your child, how many times at night, what do you give them. Other people don't go through that, and then a child then is susceptible to have caries. Having caries is rotten teeth. Other people then would say it is just baby teeth, they will fall off. No, it is not. What happens is that we call them we call these teeth directive components. What they do is that each and every baby tooth has an adult tooth coming under it. If you lose that particular tooth early or late, that old tooth or permanent tooth loses direction. That's where now you'd find people or kids with teeth that you say they have many teeth, with teeth that are so well aligned. It's because of they're not coming out on a position where they were supposed to come out. One, because of we had to take out these teeth early, or they remained for too long because of such conditions. The other one is caries. Caries is basically it is presented mostly in adults. It also goes with stages. A tooth has several layers, about 3 layers. So what happens is that the first layer is like a wall. It's protective. It does not have feelings. Even when that particular layer, like in this instance, even when that particular layer is rotten, you don't feel it as a patient. You feel nothing. Only until it gets to the second layer or even third layer, that's when we can feel pain. But we advise that before it goes there, come and treat it then, because of one of the other points, it's cheaper. You just get a patch, you get done with it. Otherwise, if you come after having it progressed, it's either you're gonna do what, you're gonna have to lose that particular tooth, or you're gonna have to rehabilitate the tooth with procedures that are expensive, the likes of root canal treatment. Should you need not to remove that particular tooth, to save a tooth that has already gone adverse stages of caries, is expensive. So hence we advise that the earlier the better. So this is basically a picture that demonstrates the layers of a tooth. That you start with this layer, it eats it away, it goes on to the second one until it gets to a layer that has nerves. If it gets there, that's when you wake up, when you're sleeping, because of it does not take a recognition of time. Anytime it depends on no trigger. Each and every time it feels like signaling that there is problem, it does so, and then you present with pain. Lastly but not least, this is simply malocclusion. Malocclusion, in most cases people say a person has many teeth. No, oftenly it is not necessarily many teeth. If you see these teeth are not so well aligned, it's because of one, that particular child might have lost teeth at a tender age where she or he was not supposed to lose teeth, or she or he might have had baby teeth for too long. So as you come to the dentist for regular visits, we do advise that it is long overdue now, this baby having these teeth. They have to go out so that the teeth that have to come underneath may not lose direction. So we find ourselves here, and then such things to treat them are expensive. For sure, you know, if you've consulted, such things to treat are expensive. Hence we go back and then advise, come for early appointments so that we may prevent all these. Edentulism is seen mostly in adults again. This is a result of the first condition we spoke about, periodontitis, where I said it is the gums. After eating the gums, it is the bone that holds the tooth, and after that the tooth shakes and then it just falls off. You cannot do anything with it. It forces us to remove all your teeth and give you dentures. Dentures is basically false teeth. Other people do happy with they are happy with the dentures, but the truth is dentures are not dentures is basically false teeth. Dentures are not natural teeth. They're not as comfortable as natural teeth. They're not as functional as natural teeth. They basically over and above. They basically there for aesthetics, for looks, so that you may not be ashamed. Well, you can use them to eat and other things, but they're not as best as having to save your teeth and use them. If you have any questions, you would rather go for references, but you can as well reach out to us and ask any questions. However, there's the list of our references, and then taking it back to the floor. I still appreciate the time that you gave me. Thank you so much. Yes, sure. Thank you. So I may take it back to you. If 5 minutes for floor, if there are questions, they may have questions before we discuss. Or the center. The center is situated by the Bradstown. It's in Bradstown. There's a tavern called Pop In One. Yeah, it's called Pop In One. Right next to Pop In One, by one way taxi rank. There is one way taxi rank. There is one way supermarket there. This supermarket is hosting. There is Pop In One. Right next to Pop In One, there's a surgery. That's where our center is. Right here in Bradstown. Yes, thank you. Any other questions maybe before we disperse? Yes, please, sure, please. Okay. So we have quite a lot. So, with Segwai. Okay, the center itself. Okay. So the center currently, what we have, it's this list. We have a physiotherapist, we have a pharmacist in house, we have an optometrist in house, we have a medical practitioner in house, and myself as a dentist. Yes. We also have others that they come in as bookings. The likes of dietitians, they share rooms with physiotherapists. The likes of this person. I don't know what they call them really, but they're nurses. What they do, they deal with skin. They're not necessarily dermatologists, but they're people that struggle with skin. So there's this thing we call them as IV boosts. So they help rejuvenate nutrients of the skin. So we also have that. Yes. No further questions. Thank you so much. Thank you so much. I also appreciate it. Thank you. Once again, thank you, Kia Kia Leboga Bagolo.